Hello, welcome to the Geri Academy podcast with your host, geriatrician Dr. Golnur Sharif Saleh, providing you with information on aging-related topics. Learn more at geriacademy.com and follow me on social media. Hello, Geri Academy listeners. I guess this is episode number 16. I have been incredibly inconsistent with recording these episodes, and I apologize for that. My goal was to record these episodes so that they align with the actual blog posts, and it may be a little bit easier to listen to sometimes than read the blog posts. But the blog posts are really only about 3 to 5 minutes long. Anyhow, let's get started. So, I have been busy opening up my new practice in Asheville, North Carolina with my partner, Dr. Marshall. Many of you know this, and our practice is called Golden Oak Medicine. We are running and operating and are starting to have patients signing on weekly, which is a wonderful blessing. And I'm also signed up for the Alzheimer's Association Walk on October 9th in Asheville. Thank you to the supporters that have been donating to our team, which is the Golden Oak Medicine team. And thank you for those who've decided to join the team and be a part of it. This disease and management of this disease is so important to me because of the way that it has changed people's lives. And I see that every single day. It is a devastating disease. And my hope and my dream is that one day we will have a cure. And I know I said this episode was going to probably be about the new medication Aduhelm by Biogen. I still don't feel comfortable enough talking about the medication because I'm still finding out more information, and I want to make sure to break down the things that I learn in a way that can be clear and understandable. And if I don't know it as well as I want to, I don't think it would be fair to tell you about it, but I will. I promise it will be coming up. Today, though, I wanted to talk about tips to better communicate with a person who's suffering from dementia. And the reason I want to do that is because the last few weeks, I've had several loved ones call me and let me know that either mom, dad, wife, husband is acting a certain way. They're getting agitated, and I don't know how to respond to them, how to help them. So I hope some of these tips will help you out or a loved one out. Always, please share Geri Academy with someone that you love and that you think may benefit from this free information. Just what I wanted to remind you again, dementia at this point is irreversible. The changes in the brain that are causing dementia cannot be stopped or turned back. Dementia gets worse over time. And the best medications that we can offer can only help delay progression of disease. And we successfully can use both pharmacologic and non-pharmacologic measures, but these are not cures. And the patients that we love will continue to decline until there is no function left. Abnormal behaviors and thoughts are very common as part of this disease. And you cannot control or change the course of disease. And you cannot control a behavior that a loved one has, but you may be able to redirect them by the energy that you bring into the communication and by the way that you respond to your loved one. Communicating with someone who is living with Alzheimer's disease or another dementia can sometimes be challenging. And dementias gradually diminish a person's ability to communicate. Communication with a person with Alzheimer's requires patience, understanding, and good listening skills. So, what I want to say first, and I always advise this, is be prepared to meet your loved one in their space. If you are depleted and are unable to meet their needs emotionally and physically, then step out and have someone else step in to help that person. And that can also provide you with some support because taking care of a person with dementia takes a village. It is a very difficult job for one person to do. So, first, be patient when you are in your loved one's space. Make sure you and your loved one have extra time. A person with dementia may sometimes require more time to process information and take longer to respond. Especially if you're going somewhere, make sure there is plenty of time for that person to get ready. Make sure you take the time to listen. Make sure that they are able to respond to your answers as you break things down, depending on the stage of their disease. Avoid distractions. One of the things that really distracts an individual with dementia is when there is a television or a radio on or there is other noise. You want to turn these things off. Close the door so your loved one can concentrate on you. If a person with dementia does not recognize you, introduce yourself before speaking. I have introduced myself to a patient several times in one sitting because sometimes my patient's memory may reset every 1 to 2 minutes, and they may start looking at me as though they have no idea who I am. So I just introduce myself again. Sometimes a person may need to introduce themselves and their role multiple times during a conversation with a person who has dementia. Do not forget that. Speak clearly and with warmth. Don't use baby talk. An individual with dementia is an adult. Respect them for the life that they have led and the fact that they are an adult. Speak slowly and in a reassuring tone. For better understanding, you may need to rephrase things. Talk about one thing at a time. Don't throw too many instructions out. Sometimes too many topics in a conversation can be overwhelming and cause stress and anxiety, which can worsen a person's behavior. Don't argue. Correcting every wrong statement may cause frustration for you and your loved one. Abnormal thoughts are a part of the disease process. If your loved one expresses these thoughts and it is not upsetting, don't correct them. Let it go. If the expressions are upsetting, you want to change the topic or the environment quickly. For example, if a loved one with dementia is telling you that they're having a hallucination, a conversation with somebody, and that conversation isn't actually going on, rather than telling them what they're experiencing is not true, you can ask them about it. Talk about the distant past. So often long term memory remains intact, and talking about the past can be soothing for your loved one. Avoid making the person remember events earlier in the day or in the past few years. That can be incredibly irritating. Try getting them to talk about things that they enjoy. Don't insist on correcting them. Sometimes let it go. Don't correct mistakes. If a loved one forgets that a spouse or child has passed, it may be upsetting if you remind them of the death of a loved one. So, just to put the context uh, where I want you to get it, just imagine hearing about the death of a loved one for the first time. Over time, you start to feel better and heal. Time heals. For a person with dementia, they may repeatedly experience a person's death because of difficulty remembering the event. Their time sort of changes, their perspective of time changes. You may want to change the subject. Sometimes patients with dementia may look around the house for someone who has already passed. Acknowledge their concern and be patient. Rather than reminding them that the person has passed away, you may just say, well, let's wait together, or let's go do something together. And while we wait, avoid certain phrases. Telling a loved one, remember, and I told you so, can be incredibly distressing. If a person with dementia asks the same question multiple times, rather than saying, don't you remember? I already told you that. Answer them like it was the first time you heard their question. When listening, Be patient in waiting for a reply. Sometimes it takes a little bit longer for an individual with dementia to process what you just said. Suggesting a word is okay. Sometimes loved ones with dementia have trouble finishing their sentences or forget common words. Observe their body language. Sometimes a person with dementia may not have the ability to express feelings or pain. Paying attention to body language can help you in understanding if your loved one is experiencing physical or mental stress. You want to listen for the feelings behind the words. If your loved one becomes upset, first, what you want to do is acknowledge his or her feelings. For example, I see you're upset, then redirect them. Suggest going outside to look at the birds. Suggest going for a walk. Offer them something to look at, like in a picture. Sometimes watching television or reading can be upsetting depending on the stage of dementia. An individual may not be distracted by those things, or you may not be able to redirect your loved one by looking at those things. And so try to understand where this person is in their stage of dementia. And your dementia providers can really help you with that. When I see someone for dementia evaluation, we, of course, perform tests to diagnose for dementia, but we also will give loved ones information on the stage of dementia. And we also counsel and help loved ones and caretakers understand what to say, how to say it, what needs an individual may have based on their dementia stage. So, as we talk about what we need to do based on a dementia stage, when giving instruction, don't command, don't demand. Break the activity down into a few simple steps. Someone with mild to moderate dementia may start having difficulty following two-step commands, especially with a person who may have even more advanced dementia. They may have difficulty managing and comprehending some very specific steps. For example, if you tell someone to set the plates, bring the dinner out, do the laundry all at once, that can be very confusing. What you may actually do is hand them the plates and say, "Can you take these to the table?" Once they're at the table, you can say, "Can you help me set these? This is how we do it." You want to show them how. Remember to assure your loved one. People with dementia are often anxious and insecure. Especially early on, people are often aware that something may be wrong and that they may not be processing information correctly. So be sensitive to their feelings and respond with warmth and comfort. Remember, in addition to words, communicate using eye contact, smiling, and gestures. And like I stated earlier, if you are depleted and you cannot help care for your loved one, if you are tired because they are asking you the same question so many times that you don't know how to answer anymore, then ask for help. Ask a loved one to step in and help you. Ask a friend to step in and help you. Ask your dementia doctor to recommend ways that you can get help. I hope this episode was helpful in providing you with some tips on how to talk to a loved one with dementia. For more information, check out jerryacademy.com. And please feel free to message me through Jerry Academy with any questions. If you're looking for a primary care provider, feel free to look us up if you live in Asheville at Golden Oak Medicine. Have a great day. Thank you for listening to this episode of the Jerry Academy podcast. Learn more at jerryacademy.com or follow me on social media for information on future episodes.